Peristeen Anal Plug is a simple and discreet aid for fecal incontinence, intended to function as a barrier to the solid output in the rectum. It takes the worry out of socializing with others and makes it a little easier to live with fecal incontinence. Peristeen Anal Plug is inserted just like a regular suppository. It's designed with a soft foam that expands to the shape of the rectum and reduces the risk of skin irritation by creating an effective seal. It's available in 2 sizes, small and large. The product should only be used after an assessment carried out by a healthcare professional. When you talk to your healthcare professional, try to determine which anal plug size works best for you and choose the one that is most effective. There are 4 simple steps in how to use the Peristeen Anal Plug. Preparation. Smear a small amount of Peristeen gel on the tip of the Peristeen Anal Plug. The Peristeen gel is provided in the box, but other lubricants recommended may be used instead. 2. Insertion. Insert the Peristeen Anal Plug gently into the anus, just as you would with a suppository. Relax your muscles and gently push the Peristeen Anal Plug just past the muscular opening of the rectum, sphincters, so that the entire Peristeen Anal Plug is inserted into the rectum. Leave the gauze hanging outside of your body. 3. Use. Once the Peristeen Anal Plug is in position, it will expand to full size as the film dissolves in the body's natural warmth and moisture. It can remain in the rectum for up to 12 hours. 4. Removal. Peristeen Anal Plug is removed by gently pulling the gauze. A fresh plug can be inserted immediately after removal of the old one if required. Peristeen Anal Plug must be removed no later than 12 hours after insertion. If you experience difficulties removing the Peristeen Anal Plug, you must contact your healthcare professional. Dispose of the used plug in a waste bin, not the toilet. The anal plug takes a little time to get used to if you have normal sensation in the rectal area. Often this is not the case for people who have reduced or impaired sensation. Contact your healthcare professional before you use Peristeen Anal Plug for the first time, as professional guidance in the use of the plug is vital. Peristeen Anal Plug must not be used if you suffer from hemorrhoids 3rd and 4th degree or anal stenosis. If you are suffering from diarrhea, the plug may be expelled. Keep it out of reach of children. If placed in the mouth, the Peristeen Anal Plug will expand and may cause choking. Before use, please consult the instructions for use document found separately in the box, as this document contains full information about indications, cautions, and warnings. Peristeen Anal Plug gives you the freedom to participate in social events or in sports activities such as swimming. And if you're using Peristeen Transanal Irrigation System, Peristeen Anal Plug can be a great complement to it.